As with other days, there are many developments to cover with this pandemic sweeping across the world. Here are today's. The British Prime Minister Boris Johnson's condition has worsened and he's now in intensive care. The 55-year-old Prime Minister has been moved on the advice of his medical team. Foreign Secretary Dominic Raab will deputise where necessary. The death toll from coronavirus in the US now stands at more than 10,000, with around 350,000 confirmed infections. US President Donald Trump has agreed to allow coronavirus patients onto a Navy hospital ship docked in New York. Japan is declaring a state of emergency as the infection rate soars across that country, with more than 3,600 cases and 84 deaths. Japan has the world's oldest population and is the world's third largest economy. South Australia has recorded its first death from COVID-19. Health authorities in New South Wales have confirmed 3 more deaths, taking the state's toll to 21. Victoria has also recorded another death, bringing that state's death toll to 11. And there's been a development in Victoria with schools. We'll get into that a little later on. Term 2 is going to be remote learning. And moving on now, the federal government will today reveal the secret modelling behind its response to the pandemic. The projections are expected to assess the impact of the response so far, including the effect that drastic physical distancing measures and travel bans are having on the spread of COVID-19. OK, so let's take a closer look at some of those developments now. British Prime Minister Boris Johnson has been moved to intensive care in hospital after his condition worsened overnight. Reporter Bridget Brennan joins us now. Bridget, so how did it get to this for Boris Johnson?
Well, Joe, you might remember 11 days ago he announced that he'd had symptoms of COVID-19 and he had indeed tested positive. Until then, he'd been self-isolating on Downing Street, working from home and still running the government. Now the UK is temporarily without its leader. He's had to deputise to the Foreign Minister, Dominic Raab. On the advice of his doctors, he's moved into a critical care unit at St Thomas's Hospital in London. So this is a very serious situation indeed. We understand that Boris Johnson needed some oxygen yesterday, some additional oxygen. He's not on a ventilator, but he is being very closely monitored by staff in that intensive care unit. And so the government has made the decision to allow Dominic Raab to step into his position for the time being. Let's have a listen to the Foreign Secretary and what he had to say about the Prime Minister's condition.
Since Sunday, the Prime Minister's been under the medical care of the team at St Thomas's Hospital after he was admitted with persistent coronavirus symptoms. During the course of this afternoon, the Prime Minister's condition worsened, and on the advice of the medical team, he was moved in to a critical care unit.
And so, Bridget, what's the very latest on his condition?
Well, what we know is that he had been struggling over the weekend with a high temperature. He gave an update to the country to say that his symptoms were persisting, and now it seems that his lung function or his oxygen levels were low, and that was perhaps why doctors wanted him to go to hospital around about 24 hours ago. So we're hoping to get more of an update. There weren't many updates from Downing Street until they said that he had been moved into that critical care unit. We know that many others within the government had also been tested positive for COVID-19, including the Health Secretary, Matt Hancock, who the Prime Minister had had close contact with. He'd had a very rough week with the virus, he said, but he recovered at home and didn't need care in a hospital. But also the Prime Minister's fiancée, Carrie Symonds, who's pregnant with their first child, she's also been unwell. She hasn't been tested, but she'd been unwell in bed for a week. So this is a clear indication of how quickly this can spread among people in close quarters and just how serious this could be for the United Kingdom.
And Bridget, just how bad is the situation in the UK right now in terms of the number of cases and deaths?
Well, it gets worse every day, Joe. 50,000 cases now confirmed in the UK, more than 5,000 deaths. Many of those hospitals in London are stretched. They're under strain. We know that tens of thousands of retired medics have gone back to the front line to fight this pandemic, but there's not been enough tests in Britain, and that's been a huge criticism of the government. It's promised 100,000 tests a day. It's nowhere near that level, and even medics are struggling to get tested and to get the protective protective equipment they need. But certainly these social distancing measures will be implemented in Britain for some time to come as they fight this pandemic.
Okay, Bridget Brennan reporting there. Now turning to Australia, in the past 24 hours there have been 49 new coronavirus infections in New South Wales and 3 deaths in New South Wales, including a former resident of the Dorothy Henderson Lodge. The latest fatalities take the number of COVID-19 deaths in the state to 21 and the number of infections to more than 2,600.
There were 49 new cases since 8 p.m. on the 6th of April. And that's down on the 57 we reported for the previous 24 hours. So as the Premier has indicated, we have seen a stabilisation and a decline in new cases. This brings to the total 2,686 cases of confirmed cases. There's been 21 deaths, and that is 3 new deaths since we reported yesterday's figures. That's in an elderly gentleman, a 90-year-old male, died in Liverpool Hospital, and he was a resident of the Opal Care, Bankstown. The second death in a resident from that facility, and a 90-year-old male who died associated with the Dorothy Henderson Lodge in Macquarie Park, and he's a 6th death in a resident from that facility. And there's an 87-year-old woman who was a passenger on the Ruby Princess, and she passed away, and that brings the deaths associated with the Ruby Princess in New South Wales to 5. As the Premier indicated, testing rates were down on the weekend. They have bounced back a bit. We had 2,100 people presenting for testing and were tested in the previous 24 hours. However, we are urging that we take this opportunity to encourage people to come forward for testing if they've got symptoms in the areas of Waverley, Wallara, Dee Why, Manly, Ryde, Macquarie Park, Broken Hill, Lake Macquarie, Manning, Nowra and South Nowra, Byron and Port Macquarie. The reason for this is in those areas we have seen a case or cases of local transmission where we haven't been able to find the source. And it is important this time, as we try and suppress the numbers of COVID-19 in the community, that we basically elevate and raise testing levels in vicinity of those areas, geographical areas, and we assure ourselves that we're not missing more broad-based transmission in those communities.
And Victoria has recorded another death from coronavirus overnight, bringing the state's death toll to 11.
Sadly, 11 Victorians have passed away, and we send our best wishes to their family and loved ones. That is one more overnight. There are 93 confirmed community transmissions. That's up a little bit, and I'm sure Professor Sutton will speak to that when we get to questions. From an enforcement point of view, 938 checks have been done and 108 infringements have been issued. There are 34 people in hospital not in ICU and a further 13 that are in intensive care. So there is some stability to those numbers as we've been commenting the last few days, and I do want to take this opportunity to thank every single Victorian that's making a profound contribution to protecting our health system and then ultimately saving lives. So I'm proud of the work you're doing, the sacrifices that you're making. I'm deeply grateful, and we are seeing positive results. However, it is very important that we not get ahead of ourselves.
Okay, so just heard the situation in New South Wales and Victoria there. I'll also just read out a media release from SA Health about South Australia's first death. Sadly, SA Health can confirm a 75-year-old man from metropolitan Adelaide passed away last night from COVID-19 in the Royal Adelaide Hospital. The man acquired COVID-19 interstate. His passing is the first death in South Australia from COVID-19. Our condolences are with the family and friends of the man. The family has asked that their privacy is respected at this time. So the number of deaths we're seeing in Australia continues to increase. The number of cases has come off and continues, well, that decline continues in New South Wales today. I think in Victoria it's bumped up a little in terms of number of confirmed cases, but the general trend has been down over the past week. We're seeing more and more deaths in Australia now, over 40 deaths.